Welcome back to the Deep Dive. Today we're really getting into something important for restorative dentistry, vertical tooth preparation. We're talking VertiPrep, BOPT, techniques that, well, they're changing things. This is for you, our dental students and young dentists listening in. Our mission, to give you the practical clinical takeaways you need.
Absolutely. And it's more than just a new technique. It's really a shift in philosophy, More conservative, better for the gums. Understanding this stuff is key to providing, well, top-notch care.
Okay, let's start right there. VertiPrep, BOPT. What exactly are they? How do they differ from the standard horizontal preps we learned, like a chamfer?
Right. So traditional horizontal preps, they have that defined finish line, your chamfer, your shoulder. It's a clear line you cut. VertiPrep, though, it's different. There's no defined finish line you create on the tooth. It's more like a feather edge, shoulderless. The idea is the margin follows the gingiva, and the final line is really determined in the lab. It becomes an area, not a line.
An area? Okay. And BOPT, is that the same thing? Or
BOPT, biologically oriented preparation technique, is a type of vertical prep, but it's more interactive with the tissue. With BOPT, you're intentionally preparing into the sulcus, removing that convexity at the CEJ, sometimes called gingitage. You're actively trying to reshape the emergence profile, working with the periodontium to create a new anatomical crown and guide the healing.
actively guiding the biology. That sounds powerful.
Yeah.
So what are the big wins here? Why should we, as clinicians, really consider these techniques? What are the advantages?
Oh, the advantages are significant. First off, tooth preservation. It's huge. You're removing much less tooth structure compared to traditional preps, especially cervically. That's critical for long-term prognosis, particularly on compromised teeth.
Less drilling, always good. What else?
Aesthetics.
Yeah.
Definitely. That feather edge allows for a really seamless transition from crown to tooth. No harsh lines. You get more control over the emergence profile, which is fantastic, especially in the anterior.
Makes sense. And you mentioned the gums, periodontal health.
Yes, that's a major benefit. Because there's no abrupt step subgingivally, there's less irritation, less risk of recession. BOPT, in particular, promotes thicker, healthier gingiva by how it guides healing with the provisional. It kind of stimulates the tissue to adapt.
Right. It's working with the tissue and the fit.
Generally, you get a very close fit and a good seal because the margin is continuous, less chance for leakage. And they're really adaptable for tricky cases, worn teeth, aesthetic challenges, teeth with previous restorations, even some perio cases.
Okay, I'm sold on the why. Let's get practical. Walk us through the steps. How do you actually do a VertiPrep?
All right, chair side. First, evaluation. Is this the right case? Check the tooth, the gums, everything. Then anesthesia, of course. Patient comfort first. Initial prep is minimal. Gentle reduction coronally with your diamond burrs. Conservative is the key word.
And the margin, the vertical part.
Exactly. Now, the vertical margin creation. No shoulder, no chamfer. Use fine-tipped burrs. Some specific ones, like from Style Italiano or Intensive, are designed for this. You're aiming for a smooth, continuous vertical finish line, often slightly subgingival, eliminating the old emergence profile.
Tissue management must be critical then.
Absolutely crucial. Tissue management. Retraction cords, maybe a double cord technique, sometimes lasers or electrosurgery. Need clear margins, no bleeding for the impression. Then the provisional. This is super important, especially in BOPT. It's not just a temp. It guides the tissue healing, stabilizes the clot, shapes that new emergence profile. You need to let it work for, say, 2 to 4 weeks.
So the temp is actually therapeutic. Interesting. Then the impression.
Yep. After the tissue matures, impression time. Digital scanning is highly recommended here for accuracy. If you're using PVS, make sure it's high precision. And that PTFE tape trick you mentioned earlier, really helpful. Rolling a bit of Teflon tape, placing it gently subgingivally, helps capture that deep margin accurately.
Great tip. Then placement.
Final restoration placement. Bond it securely. Check the fit, no overhangs. And finally, post-treatment care. Clear instructions for the patient on hygiene around the new margin.
Seems like precision is paramount. What are the common slip-ups? Where do people, especially newer dentists, tend to run into trouble?
Good question. Precision in margin creation is number one. It's easy to under or over reduce. Needs to be smooth and continuous. Impressions, as we discussed, can be tough. Getting that subgingival detail without tissue collapse. Digital helps. PTFE helps.
Right, managing the tissue.
Exactly. Poor tissue management being too rough, causing bleeding or recession, messes up the impression and the final result. Also, incorrect case selection. It's not for every single tooth. You need enough structure. And inadequate provisionals. If the temp doesn't fit well, the tissue won't heal right, and the final crown won't fit.
Makes sense. Need good communication with the lab, too, I imagine.
Definitely. The lab needs clear instructions, especially if they're not used to VertiPreps. They need to know where you intend the margin to be.
Okay, tools and materials. What should be in the arsenal for this? And what crowns work best?
For tools, good fine-tip diamond burrs, effective tissue management tools, cords, maybe laser electrosurgery, a reliable impression system, digital scanner ideally, or top-quality PVS, and definitely magnification loops or a scope. For materials, zirconia is a go-to. It's strong, can be milled thin, biocompatible, great for posteriors or bruxers. Survival rates are excellent. Lithium disilicate, EAT.max, is also great, especially for anteriors where aesthetics are key. It bonds well.
Any caveats with materials?
Well, yes. While strong, some standard zirconias, especially the cubic ones, might be prone to chipping at those thin vertical margins due to stress concentration. That's why materials like Initial Zirconia Disc HT are often recommended. They're engineered differently to handle those stresses better in thin sections. So material choice matters.
Good point. So quick recap. Vertical versus horizontal. Key differences.
Okay, quick comparison. Tooth reduction, vertical is minimal, horizontal is more. Margin, vertical is feather edge aura, horizontal is a defined line. Aesthetics, vertical often more seamless, Purio. Vertical generally better for gum health. Skill, vertical has a steeper learning curve, indications. Vertical great for worn aesthetic compromised cases. Horizontal is a bit more all-purpose.
Crystal clear. Looking ahead briefly, where are these techniques heading?
Continued improvements, definitely. Better digital workflows, CAD/CAM getting even smarter, and materials science keeps advancing stronger, more aesthetic ceramics allowing even thinner preps. It's all moving towards more minimally invasive, predictable results.
So to wrap up our deep dive today, vertical preparation, VertiPrep, BOPT, they represent a conservative, aesthetic, and biologically considerate approach. It requires precision, good technique, but offers significant benefits in preserving tooth structure and achieving excellent outcomes.
Exactly. And the final thought for you listening, as you build your skills, think about how these minimally invasive approaches might reshape your own philosophy on restorations. Don't just learn the how, but question the why and when. How can you leverage biology to get better, longer-lasting results for your patients?
Excellent point. Thank you for joining us on the deep dive. Keep learning, keep questioning, and we'll catch you on the next one.